So, good afternoon, class. I'm Sir Franz, and I'd like to welcome you back to our lessons in pharmacology. This second semester, we will be talking about the cardiovascular system, the endocrine system, and the gastrointestinal system, and more importantly, the drugs that affect these organ systems. So let's kick off our discussion um, for this semester with the cardiovascular system. So that's cardiovascular pharmacology. But for us to understand how drugs that affect this organ system work, how they work, we have to understand first how the organ system functions. So this is our outline. We will first try to learn the anatomy of the heart, and then we will go into an overview of how the circulation appears and how it functions. That is on a macro perspective. And then we will go down into the level of the tissues, how blood, plasma, and interstitial fluid calibrate with each other. And then we will take a look at how blood flow is regulated. And then um, we will try to understand how blood pressure relates to blood flow and what the determinants or the factors are um, uh, that predict blood pressure. And lastly, we will look at how blood pressure is maintained over a wide range in an acute, ibig sabihin, mabilisan na manner, and in a chronic or long-term fashion. Okay? So this is the heart. Just take a few seconds to look at the image on your left. You will see that the heart at the outset is technically a pump. It has space that receives blood, and it also has the structures that contract so that this blood is pushed into the great vessels. Okay? Sa picture pa lang, makikita nyo na that the heart, even if it is a single organ, is made up of two pumps. Okay? The right pump, which receives blood from the body, and that blood is deoxygenated, and that right pump contracts and pushes blood to the lungs, where this deoxygenated blood is oxygenated, air is exchanged, and that blood is received by the pulmonary veins, where it goes to the left pump or the left side of the heart that pumps blood to the systemic circulation. Okay, and this blood is already oxygenated, and this blood already carries sufficient nutrients and oxygen that is needed by the tissues of the systemic circulation, the rest of the body, aside from the lungs. Okay, so the right side is the pulmonary pump, and the left side is the systemic pump. And each pump system has two smaller pumps. The atria, the upper pump, is an accessory pump, which means it has little contribution to the actual pumping, but makes the reception of the ventricles of blood more efficiently. Okay, so it pumps blood so that the ventricles will receive blood in a more efficient manner. And the actual main pumps are the ventricles, which are the inferior chambers of the heart. Okay, so if you will take a look at the panel sa baba, you will see the layers of the heart. You will see the endocardium, which is the innermost layer, And the functional property of this layer of the heart is that it is very smooth. Because it is smooth, flow of blood, no, as it contacts this layer would be very smooth also. It will be laminar in nature and not turbulent. Because it is not turbulent, it prevents the formation of thrombi or clots. Okay? If it were otherwise, then blood clots will form inside the chambers of the heart. The endocardium, okay, as it is smooth, also has secretory functions. Okay? So nagsesecrete din siya ng mga substances na nagpe-prevent ng clotting at nagsesecrete din siya ng substances that help the myocardium function. Okay? The myocardium is the middle layer. Kung mapapansin nyo, siya yung pinakamakapal na layer. And as the name implies, it contains muscle. And this muscle is a special type of muscle. It is also striated. Ibig sabihin nun, meron siyang, pag tinignan mo sa microscope, meron siyang dark and light regions. But at the same time, it is different from skeletal muscle, which is also striated kasi mayroon siyang intercalated discs. Okay? And it is technically a syncytium. So, pag sinabi natin syncytium, separated siya pag tiningnan mo, but it functions as one. Why? Because the intercalated discs contain gap junctions. Ibig sabihin nun, yung mga ions that are present in one myocardiocyte is technically calibrating real time with the ions in the other myocardiocytes. Okay? So, kung magko-contract yung isang myocardiocyte because the ions are connected, then yung mga kadikit niya na myocardiocytes will also contract. So it is one, no? Syncytium siya, yung myocardium. Okay? So that forms the bulk of the wall of the heart, the myocardium. And lastly, the outermost layer will be the epicardium. So yung pericardium natin, or the tissue surrounding the heart, that's the outermost layer. You have a visceral pericardium, which is in direct contact with the myocardium. Then you have a space, and that is a potential space, no? That is filled with fluid. Okay? And the function of this fluid is it provides lubrication. It provides a safe space for the movement of the heart itself, and it provides a space where potential diseases can occur. No? So yung fluid na to, it can become filled with excess fluid. Yung space na to can become filled with excess fluid, and yung pag-develop ng excess fluid na to, kung mabilis or mabagal, yun yung magdidictate kung anong klase ng manifestations ang makikita sa pasyente. And after this space that is filled with fluid is the outermost layer of the pericardium, which is the epicardium itself, which is filled with collagen. And so you will almost always see it as the fibrous pericardium in literature. Okay? So kung mapapansin nyo din sa image, yung heart is connected to the great vessels of the body. And you have arteries, no? The pulmonary trunk, which carries blood from the right ventricle towards the lungs, and the aorta, which carries blood from the left ventricle towards the systemic circulation. And embryologically, no, the pulmonary trunk and aorta come from one big artery. And as the fetus develops, nagkakaroon ng separation yung dalawa. No? You have also the great veins of the body, which carry blood back to the heart, the vena cava, superior and inferior vena cava, carrying deoxygenated blood from the systemic circulation, and the pulmonary veins, which carry oxygenated blood from the lungs back to the left side of the heart where it can be pumped. Okay? The heart is also innervated by parasympathetic and sympathetic fibers. The parasympathetic fibers, which release acetylcholine, come from the vagus nerve, which is cranial nerve 10. And the sympathetic nerves come from the spinal cord through spinal nerves that come from the thoracic level of the spinal cord. So, eto namang sympathetic nerves, they give off epinephrine and norepinephrine. And if you will review your lessons in autonomic nervous system pharmacology, you will know that these neurotransmitters will have differing effects based on the presence of the specific types of receptors in the heart. Okay? So this is the overview of the circulation. Tingnan lang muna natin, no, kung paano na-structure itong circulation ng katawan. Yung blue, that would be the venous circulation and even the circulation feeding the lungs. Okay? So kung mapapansin nyo, the systemic circulation will fuse continuously to form larger veins up until it reaches the right side of the heart, which is basically just above the diaphragm. And at this point, the superior and the inferior vena cava have fused to form a very big vessel that directly is part of the right atrium. Okay? So blood from the systemic circulation goes down through this path to reach the right ventricle. And then yung pula naman, that would be the arterial system, carrying oxygenated blood, except the lungs. Pula din siya, but at this side, that is already the pulmonary vein. Okay? So that's forward flow from the left side of the heart, the left ventricle, forward flow, arterial, and then capillary beds of the tissue, and then the venous side of the circulation where flow is back towards the heart. Okay? So, appreciate that. Tingnan din natin yung relative percentages. Okay? Yung Q, dyan, that means perfusion. Okay? So, tingnan natin. The brain is perfused 13% of the cardiac output. Ano ibig sabihin nun? Every pump of the heart, no, yung volume of blood na yon, 13% of it all goes to the brain. Let's look at the myocardium, or the coronary circulation, the special circulation of the heart. It receives 4% of its own cardiac output. Okay? The liver and gastrointestinal tract receives 24%. And the skeletal muscle, which makes up majority of the weight of the human, takes up 21%. And that can increase when the human is exercising or using the muscle actively. The kidney receives 20%. Okay? The skin and other organs receive 18% of the cardiac output. So, kung mapapansin nyo, 13% of the cardiac output, 18% of it all goes to the brain. Let's look at the myocardium, or the coronary circulation, the special circulation of the heart. It receives 4% of its own cardiac output. balance yon, no? Yung one-fifth, 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 and another one-fifth, they make up, so limang one-fifths will make up one whole, and that is the entire cardiac output. But what I want you to appreciate right now is that kung titingnan mo siya, blood flow per gram of tissue, no? Yung pinakamagaan dyan would be the brain, but it receives 13% of the entire cardiac output, which means yung blood flow per gram of brain tissue would be very high. And why is that? Tingnan naman natin ngayon yung volume of oxygen, VO2. Okay? So, the brain, 21% of oxygen consumption, 11% of total oxygen consumption yung sa heart, 23% yung sa liver and gastrointestinal tract, which we entirely call as the splanchnic circulation, 27% for the muscle, and bababa or tataas depending on exercise. The kidney will actively take up 7%, and the skin and the other organs will take up 11%. Okay, so from this, you will be able to infer that dependent on the level of metabolism will the uptake of oxygen be, and correspondingly, the amount of blood flow that is consumed by the organ per cardiac output. Okay? So, yon. That's the overview in itself, no? But let's just take and understand some salient points. The pulmonary circuit has low resistance in extrauterine life. Why? Because the lungs of the fetus is essentially the placenta. The placenta takes up the exchange function of the lungs in the fetus. So when the baby is born already and the baby is separated from the placenta, the lungs will have to take over the oxygenating function. So when the lungs expand, okay, the alveoli expand, it also relieves the tethering of the blood vessels. And so the pulmonary circulation, once the alveoli, kung saan yung air ay present, once the alveoli expand, the blood vessels also expand. And so the moment that the baby takes its first breath, this resistance drops dramatically. And so blood will want to flow into the lungs because the resistance to blood flow is very low. Okay? Next, veins are capacitance vessels and they hold majority of blood in the body's closed circuit. You have to understand that the circulatory system is a closed circuit where portions of the circulatory system are in direct contact with other portions of blood elsewhere in the body. And there is no blood that is leaking out. It is a closed circuit. If it is a closed circuit, then ibig sabihin nun, yung amount of blood within that circuit is constant. But differing yung dami ng dugo, differing yung dami ng dugo per type of blood vessel. Yung veins, if you will recall the structure of the veins, they are very wide, they have very big lumen, and their walls are thin, as if they are really built to hold blood. So in this light, veins are capacitance vessels para siyang baterya that will hold the charge, no, in an electric circuit. Much so like that, veins will hold the blood for the entire circulatory system. Dahil ganun yung structure niya. So, ano yung importance nun? Kapag yung organs ng katawan nakukulangan na ng dugo, anong pwedeng gawin ng veins? They will contract. And by contracting, they will squeeze the blood which they are holding back into the circulatory system so that the need for blood is um, ano tawag dyan? The need for blood is ano tawag dyan? Ako ng English, nami-meet. Ganyan. So the need for blood is met by the contraction of the veins. Ngayon, tingnan nyo yung panel A ng figure na may pie chart. Kung makikita nyo, ang title niya is volume distribution, which means for the 5 liters, that is the average blood volume, 64% noon hinahawakan ng veins. Okay? And anong ibig sabihin nun? The remaining 36% is what is present in the remainder of the circulatory system, the lungs, the arteries, no? Large and small arteries, the heart in diastole, which is in relaxation mode, which means it is being filled. So 7% yon, and the capillaries 5%. So that means na etong 64% na to, pwede siyang ma-mobilize anytime that it is needed. Okay? So next, resistance to blood flow and perfusion is attributed to small arterial systems, and this enables tissue shunting. So if blood volume is held in the veins, the resistance to blood flow is contributed by the arteries. Why? Kung titingnan nyo yung structure ng isang artery, yung vessel niya, yung vessel wall, sobrang dami ng contribution ng smooth muscle. Ko-compare mo yon sa structure ng veins, konti lang yung smooth muscle. Sa arteries, marami. So, when these smooth muscles contract, the lumen of the artery will constrict, liliit. Okay? And that decrease in the lumen of the artery will contribute to the resistance to blood flow. Isipin nyo parang hose, no? Kapag naglagay kayo ng finger ninyo doon sa tip ng hose, yung pressure, no, ng tubig as it goes out, sobrang lakas or lumalakas kapag nililiitan nyo yung lumen. So, ganun din siya, no? Yung arteries, once they constrict, they will create high pressure and they will contribute to resistance. In a macro perspective, kung susumahin mo lahat ng resistance na yon on the arterial side, yun yung kailangan na force na i-overcome ng left ventricle. Okay? So, kailangan mag-generate yung left ventricle ng enough force to overcome that resistance so that blood can flow on that side of the circulation. Okay, so ano naman itong concept ng tissue blood flow shunting? Lahat kasi ng cells ng katawan, nangangailangan siya ng oxygen and nutrients. But silang lahat ng tissues ng katawan, magkakaiba yung importance nila. Of course, mas importante yung utak kaysa sa balat than the skin. So if you will direct your attention, the skin and other organs take up 18% of the blood flow. Okay? The brain takes up 13%. But understand, kapag nagkaroon ng pagdudugo, hemorrhage, and the volume of blood is continuously decreasing. Okay? Of course, you would want to preserve blood flow to the brain. Okay, so what does the body do? Yung arteries na nagsusupply sa skin, magko-constrict yon. Pag nag-constrict siya, magko-contract yung smooth muscle sa wall ng blood vessel and the artery will constrict. Pag nag-constrict siya, liliit yung lumen. Ito, mahirap nang pupunta yung dugo dito kasi sarado na siya. So it will have to flow elsewhere. And the arteries, sobrang amazing na yung arteries that supply the brain, they remain constantly dilated. And they will dilate more so that blood flow towards the brain is of low resistance and blood can flow towards the brain in that instance na nag-hemorrhage. Okay? So, let's see. The next one. The most metabolically active tissues require the greatest blood flow. Okay? So, na-explain natin kanina. Yung oxygen at saka yung nutrients na kinikerry ng blood, those are used by the cells. So if the cells create a lot of ATP, they will need a lot of oxygen and nutrients. And so blood flow towards them should be very high. Okay? So maraming application yan, but I just like to state this example. When a patient has hyperthyroidism and the metabolism of the body is very high dahil sa excess thyroid hormone, all of the tissues of the body will require a lot of nutrient and oxygen. And so the blood vessels serving the tissues of the body will be tonically dilated, no? Constitutively dilated dahil doon. So, anong mangyayari? The heart will really have to pump more efficiently, faster, more blood flow to the tissues kasi ang lakas ng metabolism. The heart will then compensate, no? Kasi malaki yung demand from the heart. So the heart will enlarge and the heart chambers will dilate and the heart muscles will thicken but mas malaki yung pagdilate niya. So that leads to high output heart failure in uncontrolled hyperthyroidism. Okay, kaya it is really a dilemma, yung hyperthyroidism. Okay. Next, let's go to the microcirculation. So, kanina yung diniscuss natin, what is the blood flow on a bigger perspective. Right now, we're looking at how the exchange between the capillaries and the fluid surrounding the cells, how that exchange happens or occurs. Okay? So, remember that the end goal of circulation would be to provide to the tissues oxygen and nutrients and the byproducts of metabolism, wastes, and carbon dioxide. That is also the goal to remove those. Okay, so that is the goal of circulation. And how does it occur at the level of the tissues? So first, understand that the structure is like this. Okay, focus your attention on the image on the left. Arteriole and venule. Okay, arterioles are small arteries and venules are small veins. And as the arteries progressively become smaller, mapapansin ninyo that the amount of smooth muscle per gram of artery increases. Okay, so that yung mga sobrang liit na mga arteries, the arterioles, sobrang dami ng smooth muscle doon. Ano ibig sabihin nun? Sila din yung nagko-contribute ng constriction at ng majority ng peripheral vascular resistance or resistance sa blood flow. Tingnan nyo, napapalibutan talaga siya ng smooth muscle. Okay? And there will be the formation of capillaries. And technically, the capillaries are just the communication of arterioles and venules. Okay? So yung capillaries, it's only one cell thick. Ganun na lang siya kanipis, no? Pagdating sa capillary. Okay. Red pa, oxygenated pa, and then exchange occurs, okay, between the tissues and the blood, no? Oxygen, nutrients, carbon dioxide, and wastes. And then you form the pre-venule capillaries, then the venule itself. So as blood flows through this system, the exchange occurs. Okay. So now direct your attention to the capillary on the right of your screen. So net filtration of fluid and therefore the oxygens and the nutrients na kaakibat nun is determined by 4 pressures. Okay? So this is Starling's equation. Capillary pressure, ibig sabihin lang yan, ano yung puwersa ng blood within the capillary pushing the fluid outside. So that's hydrostatic capillary pressure. Okay? That is a force that helps filtration of fluid. Within the capillary wall, mayroon din tayong plasma colloid osmotic pressure. Ito naman, isipin nyo, yung blood and the plasma, mayroon niyang mga plasma proteins, di ba, and solutes. Yung mga plasma proteins and solutes na yun, they would want to hold the water within the capillary. So, kung yung capillary pressure, pinupush niya yung tubig palabas, yung plasma colloid osmotic pressure, hinihila niya yung tubig paloob. Okay? Next, forces outside naman, nandun naman sa tissue area. Interstitial fluid pressure. So ito, puwersa ng tubig sa labas ng capillary na nagpupush ng tubig para pumaloob. Okay? So yun yon. Next, interstitial fluid colloid osmotic, ang haba, osmotic pressure. Ito naman, puwersa na nang hihigop ng tubig palabas ng capillary papunta sa tissue. Okay? So, yan sila nagbabalanse. Okay? Nagbabalanse yan siya. And the net effect is filtration of fluid. So, kahit magbalanse yan sila, at the end of the day, a little bit of fluid will be pushed out of the capillaries into the interstitial tissue. Okay? So, okay. So, whenever there will be disease states, nag-iiba yung balanse ng mga pressures na to, and we will see an imbalance of this pressure as edema, okay, or pamamanas. So, for example, fluid retention in heart failure. When the heart is not able to pump blood forward into the arterial side, blood will dam up into the venous side. And so, yung veins, mataas ang pressure dito. And so, etong mga capillaries na to, mataas ang pressure sa loob. Okay, so the hydrostatic capillary pressure will increase and that will lead to fluid exuding the capillary and fluid collecting in the interstitium, and you will see that as edema. So, kapag gumamit ang isang pasyente ng calcium channel blocker, which is an antihypertensive, which we will learn in the next lessons, there will be vascular atony. So, yung smooth muscle ng arterioles nagre-relax. And so, yung arteriole nagdadilate. And so, blood flowing or filling the capillaries increases. And so, the capillary pressure increases. Okay? So, when the capillary pressure increases, the filtration of fluid will also increase. Next, hypoalbuminemia in cirrhosis. So, kapag yung atay, napapalitan na ng scar tissue kasi nasisira siya, yung function ng atay na gumawa ng albumin decreases. So, kapag yung albumin sa dugo kumukonte, bumababa ang plasma colloid osmotic pressure. Okay? Etong nasa right. Yung plasma colloid osmotic pressure na hihigop ng tubig so that it remains within the capillary goes down. So as that pressure goes down, it will help with the filtration of fluid. And so, fluid will collect in the interstitium or the extracellular space, and that will be manifested in the patient as edema also. Okay? So that's microcirculation. And so, we look at the lymphatic system. So, yung lymphatic system, it is also part of the circulatory system, but it is outside of the arteries, the veins, and the capillaries. Meron din siyang kagaya ng mga blood vessels, no? Meron ding endothelium, and it is also filled with fluid. So, imagine niyo siya um, para siyang sponge that is constantly being filled with water, and yung nahihigop niya, yung na-absorb niyang water, binabalik niya sa veins ng katawan. So, kanina, nalaman ninyo na always, kahit in the normal setup, na-favor yung filtration. Merong nagagawang tubig that fills the extracellular space. So if there is no way to reabsorb that water, mahirap yun, no? So the way to reabsorb that water is via the lymphatic system. So if you will look at the image on the left, okay, so yung net filtration pressure is around, okay, so capillary 28, plasma 30, pressure 20, okay, 2, pressure 10. So you have a net of 8. Okay, so the net filtration pressure is 8. But all of this fluid is reabsorbed by the lymphatic vessel. Okay? So, wag mo na yung numbers. Tingnan na lang natin itong image on the right. So, yung na-form na fluid ng plasma is what you call interstitial fluid, and the lymphatic system absorbs up to 12 liters of that every day, and the fluid is basically siphoned, parang hinihigop ng lymphatic system. And as the lymphatic system reabsorbs this fluid, dumadaan siya sa inyong lymph nodes or colony. And housed within these lymph nodes are macrophages and lymphocytes that in a way cleans the blood of dead cells, cleans the lymph fluid of dead cells, and bacteria. Okay, so that yung ibabalik niya sa venous angles would be already clean plasma. So the lymph vessels are one-way valves, and like veins, they form progressively larger structures. And dito sa leeg natin, mayroong sobrang laking lymph vessel that inserts into the venous angle, no? So ito internal jugular at saka ito subclavian vein. So dito siya mag-i-insert, and so maibabalik niya yung na-filter out na fluid pabalik sa dugo. Okay? But habang na-filter niyo yun, remember, dumadaan siya sa inyong lymph nodes na mayroong macrophage na kukuha ng debris at mayroong mga lymphocytes na magsasample ng mga antigens para malaman niya kung kailangan niyang gumawa ng mga antibodies against foreign tissue. So technically, yung lymph nodes nyo, para siyang gland na gumagawa ng fluid na filled with antibodies. But imagine niyo kalat-kalat itong mga lymph nodes na to sa buong katawan, except the central nervous system. Okay? Okay. So, net filtration can increase multiple times. So, yung equation na tiningnan natin a while ago, kung saan merong hydrostatic pressure, colloid osmotic pressure, interstitial colloid and hydrostatic pressures, kahit pa sobrang lakas ng pag-filter out ng water, yung lymphatic system, meron siyang edema factor na kaya niyang i-reabsorb up to 21 times of the filtration pressure before the edema develops. So, or ang pamamanas mag-develop. So, imagine niyo kapag namanas na, yung volume of fluid that is filtered is much more than 21 times. Okay, so ibig sabihin, sobrang dami talagang lumalabas na fluid para ikaw ay magmanas. No? Or, ma-block yung iyong lymphatic vessels. Kung na-block siya, then the reabsorption is truncated and therefore magmamanas ka. Okay, so ano yung mga diseases na pwedeng mag-block? Pwedeng may tumor na binlock niya yung lymph node, okay? Or merong mga inflammatory cells na maga yung lymph node kasi merong infection na nakuha yung mga macrophages. Okay, so that time, pag na-block, kahit normal lang yung filtration, dahil wala siyang efflux, wala siyang outflow, magmamanas ka. Okay? Okay. So right now, we're trying to understand how the body determines how much blood goes into that particular region of tissues or the body. Okay? So the goal of blood flow regulation is to meet the metabolic demands of living tissue. And regulation of blood flow can be accomplished through two ways, autoregulation and external regulation. Dito sa dalawa, autoregulation ang pinaka-powerful. Okay? Siya yung nagdi-dictate sa most of the responses ng katawan kung sa pangangailangan ng blood flow. So ito yung mas nafa-follow. And lately, they found out that by altering the mechanisms of autoregulation, na they are able to create more lasting and more potent effects on the requirements of blood flow and how to alter them. Okay, so okay. So yung autoregulation, meron siyang dalawang primary mechanisms. Number one is the myogenic mechanism, and number two is vasodilation by ways of the endothelial cell. Okay, so ano ibig sabihin nun? Unahin natin yung microcirculatory vasodilation that is mediated by endothelial metabolism. So, kailangan yung maintindihan na yung capillaries ng katawan, okay, are embedded into the tissues of the body that they subserve. Yung kanilang pinoprovide ng oxygen and nutrients, they are parang dikit sila doon. Okay? So kung ang region of tissue na ito, nagpo-produce siya ng maraming carbon dioxide. Okay? Yung carbon dioxide na yon nasa-sense ng endothelium, ng wall ng capillary. Nasa-sense niya na ang dami ng carbon dioxide dito. So, iintindihin niya yon as if, ang dami ng carbon dioxide. Ibig sabihin nun, mas kailangan niya ng mas maraming dugo o blood flow to provide the oxygen and the nutrients na gagamitin niya for its own metabolism. So, pagkaintindi nun ng endothelial cell, siya ay magre-release ngayon ng mga factors kagaya ng nitric oxide at ng other vasodilators para yung caliber ng arteries na nag-feed sa capillary na yun ay lumaki. Kapag lumaki or nag-vasodilate yung mga arteries na yun, they will receive the tissue that originally produced the carbon dioxide will receive sufficient blood flow, no, to produce negative feedback para tumigil yung pag-produce niya ng mas maraming carbon dioxide than usual. Okay, so ulitin ko. Yung tissue na nakukulangan ng oxygen, it will produce more carbon dioxide than usual. Nagiging inefficient yung metabolism niya. So remember, oxidative metabolism via the electron transport chain compared to provision of production of lactate, production of ATP through lactate. So yung lactate na yon, i-release na yung acid na yon, masisense ng endothelium kasama ng carbon dioxide. So, kulang yung oxygen, nag-produce ng acid at carbon dioxide na sense ng endothelium. Yung endothelium nag-release ng vasodilators. Nung nag-vasodilate na, dumami yung blood flow, na-contradict niya yung stimulus that produced the increase in carbon dioxide per oxygen ratio. So, next, myogenic mechanism. Ang blood vessel, super smart niya na kung marami yung blood flow papunta sa region na yon ng blood vessel na yon, it will stretch out that blood vessel, and automatically, once the blood vessel is stretched out, there will be a reflex that will cause the blood vessel to contract. Okay, so na-stretch out siya dahil sa sobrang dami ng blood flow. Ngayon, automatically, by a reflex, magko-contract siya to return the caliber of the blood vessel towards normal. But when the need for that particular tissue of blood is very high, then that myogenic reflex is overcome by the vasodilation, that is produced by the release of vasodilatory substances by the endothelium. Okay, so yun yung una, autoregulation. Next, yung external regulation naman ay nakadepende, okay, sa paglaki at pagliit ng caliber ng bigger vessels. Okay? At itong bigger blood vessels na ito, they respond via constriction and dilation mediated by the release of neurotransmitters and hormones. Okay? So kagaya ng angiotensin 2 at ng epinephrine. Those are very potent vasoconstrictors. So pag iyong napa-vasoconstrict ang isang malaking artery, medium-sized artery, muscular arteries, and the intermediate-sized arterioles, then blood flow to the region na sinusuplayan ng artery na yun decreases. Okay? So, yun yung sinabi ko kanina, yung pag-shunt ng blood flow. Okay? Isa pa, kapag iyong ginawang mas avid ang pag-function ng puso, mas malakas yung pag-contract niya, mas mabilis yung kanyang pag-contract, then yung cardiac output, ibig sabihin the volume of blood that is pushed by the heart into the circulation per minute, yun ay nag-i-increase also. And so, that will translate to increase in blood flow sa regions ng katawan na nagre-receive ng dugo na yon na pinump ng puso. So those are the two external mechanisms. You control the intermediate to medium-sized vascular beds, and number two, iyong papalakasin ang pagpwersa ng puso. Ang pagpump ng puso, yung pwersa ng dugo na galing sa puso. So, those are the external ways by which blood flow is regulated. So, yun din yung most of the determinants of blood pressure, dun siya pumapasok. But again, I like to emphasize that the most powerful means of controlling blood flow, not blood pressure, so magkaiba yon yung blood flow and blood pressure. Yung mas powerful na way of controlling blood flow is autoregulation. Okay, so let's just take a look at these figures. No, in panel A is reactive hyperemia. So that's ganito lang siya. Meron kang piece of tissue and then merong artery na nagsusupply sa tissue na yun. Pag binara mo yung artery, ibig sabihin yung tissue na yun, hindi siya makakakuha ng dugo. So, without blood, there won't be oxygen. Without oxygen, the cells of that tissue will have to resort to alternative ways of producing ATP. Yung hindi masyadong nakadepende on oxygen. So, ibig sabihin, it is outside the electron transfer chain. And so, one way of producing ATP in the absence of oxygen would be anaerobic glycolysis. So, remember your biochemistry, anaerobic glycolysis. And the byproduct of that is lactate. Once lactic acid builds up in that region of tissue, it will stimulate the endothelium to vasodilate. Okay, but aside from that, if we release the blockade of that artery, the blood flow towards that tissue increases more than the usual. So, tingnan mo, nilampasan niya yung dotted line. It it received blood more than its usual. Kasi nga, merong time na na-occlude siya. Okay, so ano ibig sabihin nun? Yung tissues na yon na na-block yung blood flow sa kanila, magko-compensate siya by receiving more blood once blood flow is restored. Okay, so that is the concept of reactive hyperemia. Reactive kasi, it is a reaction to the occlusion. Okay, so makikita nyo naman siya dito sa panel A. Yung panel B, that's active hyperemia. So, imagine niyo merong, let's say, muscle that is exercising. And that muscle is outputting a lot of carbon dioxide and taking in a lot of oxygen. The endothelium will be able to sense na, ay, malaki na ang pangangailangan nito. So, ang gagawin niya, it will, without the occlusion, it will anticipate the need and vasodilate. So that is active hyperemia. That is one way also of microcirculatory vasodilation. Okay. And lastly, yung myogenic regulation. Sabi ko, kapag na-stretch yung wall ng blood vessel, it will automatically constrict, no, to prevent excess stretch. So dito sa purple na panel, kung titingnan nyo, tumaas yung blood flow, and then ibig sabihin na at that time nasa stretch na siya, no, yung blood vessel wall. Siya naman ngayon ay magko-constrict, no, to maintain blood flow to a certain point. So bababaan niya yung perfusion kasi nagko-constrict na siya. Kung nakikita niyo yung purple, after niyang tumaas, bababa din siya. After niyang ma-stretch yung blood vessel wall, magko-constrict siya. Okay? So, the first thing that I'd like you to understand is that blood pressure is different from blood flow. Blood pressure is the force of blood acting on the walls of the blood vessel. Okay? So, blood flow naman ay yung pag-flow ng blood. It's different from blood pressure. So, okay. The heart has to generate enough force to propel blood against the resistance generated by blood vessels supplying a region of tissue. Yun yung sinabi ko kanina. Kung ano yung tonicity noong arterioles, yung laki ng butas ng lumen, yun yung that will sum up as resistance that has to be overcome by the left ventricle in matters of force. So, hindi magkukos ng forward flow yung dugo, no? Hindi siya magfo-flow it won't flow to the tissues if the heart won't be able to produce enough pressure to overcome that resistance. Okay, so nakuha niyo yun. Okay. So, preload, so these are important terms that you should understand. Kasi yung mga gamot natin, they can also be classified as preload unloaders or afterload unloaders. Okay, yung mga gamot for hypertension. So first, what is preload? Preload is the force that is contributed by the weight of blood pressing against the walls of the heart as it is filled. So remember, yung walls ng heart it is around a chamber. And that space, the chamber, is filled with blood. So the stretch that is given off by the blood as it lies against the wall of the heart, that is preload. Okay? So technically, kung isipin niyo siya in that way, preload means ano yung timbang ng dugo. And kung ano yung timbang ng dugo, ano yung dami ng dugo that presses on the wall of the heart. So that is preload. Why should it be overcome by the heart? Kasi kailangan mag-squeeze nung chamber ng puso. Isi-squeeze niya dapat yung blood on it inside yung blood inside the chamber will have to be squeezed, and the force of the contraction transmitted into the blood. Kumbaga parang ini-energize mo yung dugo para gumalaw siya, and it has to have enough energy para pwersahin yung sarili niya against resistance that is present on the greater vessels of the body sa aorta. So imagine niyo yung arterioles that supply a region of tissue. Okay? Yung pagka-open or pagka-close niya ng lumen that provides resistance. All of those resistances will add up as you go back towards the heart, so that at the aorta, the pressure will be very high. That pressure that is present on the aorta, that resistance, kailangan mag-generate ang puso ng enough force na kontrahin yung resistance na yun so that blood can pass through the aorta. How does the heart generate that pressure? By contracting and squeezing that chamber where blood is present. So, kung marami yung dugo na nandoon sa chamber na yon, malaki din yung kailangan na pwersa na i-generate ng puso to pump all of that blood. Okay? But here, I'd like to direct your attention sa image on the left, sa diagram sa left na yan. Okay? Papansin nyo, dyan muna tayo sa normal contractility, yung graph na yan. As the preload increases, no, as the volume of blood increases, okay, as the volume of blood that presses on the wall of the heart increases, stroke volume also increases. Stroke volume means the volume of blood that is pumped out by the heart per contraction. As preload increases, the stroke volume increases. So, kumbaga, kung mas marami yung nare-receive na dugo ng puso, mas marami din yung pinapump niya na dugo. Ano ibig sabihin nun? Mas marami din yung force na gine-generate niya to pump all of that blood. Mas marami yung blood na pumasok, mas marami yung force na generate niya. And that precisely is what we call the Frank-Starling mechanism. No? Mas marami yung ni-receive niya, mas marami yung i-output niya. So, paano nangyayari yung Frank-Starling mechanism? You have to recall your lessons in anatomy, okay, and physiology, that muscle is made up of actin and myosin. Okay? Myosin and actin. So, di ba nakaganon siya? Yung pag-stretch ng puso, pag-stretch ng walls ng heart, kasi dumami yung dugo na bumalik sa puso, that will create optimal stretch also at the actin and myosin fibers. So when the actin and myosin fibers are stretched optimally, they will contract optimally. And so when the heart wall is stretched, it will contract more optimally because it is stretched more optimally. It will generate more force. So by increasing preload, you increase stroke volume via that mechanism. And that is the Frank-Starling mechanism. So whenever the heart is exercising, whenever you are exercising, there is increase in the release of norepinephrine kasi nag-exercise kayo. And norepinephrine, by acting on its receptors, increases contractility. So the graph shifts to the left. Okay? Konti lang for this level of preload. For a certain level of preload, the stroke volume increases so much when there is increased contractility. The heart muscle is just so efficient in pumping out that blood because it has been primed, it has been made more active by the action of, let's say, epinephrine acting on the beta-1 receptor. Okay? So that is a state of increased contractility. What about a state of decreased contractility? For example, when the coronary arteries supplying the myocardium of the heart with oxygen and nutrients becomes blocked, no? Then ibig sabihin nun, blood that nourishes and supplies the myocardium decreases, blood flow decreases. So when does that happen? When you have an MI or a myocardial infarction. Okay? When oxygenation and nutrient delivery to the myocardium decreases, its contractility also decreases. So that for a certain level of preload, it is not able to pump enough blood out of the heart. Okay? So, nai-imagine nyo ba ano yung mga nangyayari sa puso, sa function ng puso when that happens? Okay? As in the setting of a myocardial infarction. Ang cheesy nung animations ko. Anyway, after load naman, I was already referring to this ulit-ulit, no? After load is the force which is contributed by the caliber of the blood vessels distal to the heart. Okay, that is the summation of all the resistances given off by the artery, which the heart has to pump against. Okay? So, anong ibig sabihin nito? When we are able to alter the tonicity of the arterioles, we are able to control how easy or how hard the heart has to pump. Okay? So, ano ibig sabihin nun? Kung yung puso nahihirapan siyang mag-pump ng blood, okay? Pwede mo siyang tulungan. Pwede mong paluwagin yung tonicity. Pwede mong sabihan yung arterioles to, hey, dilate so that your resistance increases. And when your resistance increases, the heart won't have to counteract you as hard as it has to. Okay? So, ano ibig sabihin nun? Konting force lang generated by the heart, it is able to already cause blood to flow forward. Kasi yung kontra niya mababa, and that is afterload. So we have preload unloaders. for the control of hypertension. And we have afterload unloaders for the control of hypertension. Okay, but that is just one application. No, another application is in shock, when the tissues are just not receiving enough blood. No, you can pharmacologically manipulate. Pwede mong palakasin yung tibok ng puso so that force and forward flow increases, and at the same time cause vasodilation so that flow towards the tissues increases. Okay, so that's a type of treatment for a type of shock. Okay. Okay. So those are the determinants of blood pressure: preload, basically, and afterload. So this is a very good illustration showing you the relationship of the different determinants of blood pressure and how they change. Okay? So first, blood pressure is determined by cardiac output. Okay? Yung na-measure nyo na pressure on the artery, sample in your arm, is always due to two things. Gaano kadami yung flow ng dugo, gaano kadami yung pinapump ng puso via cardiac output. So kung mas marami yung pinapump, kasi mas malaki yung cardiac output, mas mataas yung force na nag-act on the blood vessel. And so mas mataas yung blood pressure. And the other way around also, if the other determinant is total peripheral resistance. Gaano ba kahigpit yung pag-close ng lumen ng artery mo? If, for example, a certain amount of blood is flowing through that artery, and your artery is constricted, then the pressure will be high kasi mas iniipit niya yung blood inside. But if that artery is dilated with the same amount of blood flowing through it, then the pressure will be low kasi hindi niya naiipit yung dugo inside. Okay, so ganun yung siya isipin. Mean arterial pressure, always a function of two things: cardiac output and total peripheral resistance. Next, what are the factors that determine cardiac output? Remember, cardiac output is the volume of blood that is pumped by the heart per minute. So ano ibig sabihin nun? It is the volume of blood that it is determined by the volume of blood pumped by the heart per beat, and that is stroke volume. Again, stroke volume, the volume of blood pumped out by the heart per beat. And heart rate, how many beats are present in each minute? Okay, so those two determine cardiac output. So example, the stroke volume does not change. Each time the heart pumps, ito yung set amount of blood that is pumped. But the heart rate increases. So yung cardiac output mo, tumataas. Okay? So, heart rate then, gaano kabilis yung tibok per minute, is determined by sympathetic activity and parasympathetic activity. By action of the sympathetic nervous system, bibilis yung heart rate, and without changing the stroke volume, that means you have a high cardiac output and a higher mean arterial blood pressure. Parasympathetic activity on the heart, opposite naman. Papabagalan niya yung heart rate. Okay, papababain niya. So that for the same amount of blood pumped by the heart per pump, lower heart rate, you will have a lower cardiac output and therefore a lower mean arterial blood pressure. Okay? But yung sympathetic nervous system, sabi ko nga kanina, hindi lang sa heart rate yung talab niya. Yung receptors niya, hindi mo lang makikita sa cardiac conduction system. Makikita mo din siya sa muscle mismo ng puso. Once na-activate yung receptor ng epinephrine, that is the beta-1 receptor, on the cardiac muscle, papalakasin niya din yung force mismo ng pag-contract. So that for the same heart rate, o dito naman, constant yung heart rate mo. Pag lumakas yung pag-contract ng puso, the stroke volume increases kasi more force generated, di ba? Kasi mas nag-contract yung heart muscle. The stroke volume increases. For the same heart rate, the cardiac output increases and the mean arterial blood pressure increases. Okay? Next, dinescribe ko kanina sa preload yung Frank-Starling mechanism. And in other terms, that can be venous return. How much blood comes back to the heart, no? So, how much blood enters the right atrium and the right ventricle would technically be the same amount of blood that should be pumped out by the heart. Nakuha niyo yun? Yung dugo na bumabalik by way of the veins, the venous return, should always equal the cardiac output. What amount of blood goes out of the heart. And why are they almost equal all the time? Kasi pag tumaas yung venous return, more stretching on the heart wall, more efficient contraction, stroke volume increase. Okay? Mas madami yung bumabalik, mas malakas yung pagpump. Okay, Frank-Starling mechanism. And so, how does it affect blood pressure? For the same heart rate, so example, 60 beats per minute. Kung ang venous return, amount of the volume of blood going back to the heart is low, then that will produce low stroke volume, therefore low cardiac output and low mean arterial blood pressure. But if the volume in the body is high, for the same heart rate, you will have high venous return, Frank-Starling mechanism, high stroke volume, high cardiac output, high blood pressure. Okay? So, next, venous return, gaano kadami yung blood na bumabalik sa puso, logically is determined by how much blood there is in the circulatory system. Gaano ba kadami yung dugo? And gaano kadami yung dugo would be determined by how much plasma is present. So, kung malaki yung plasma, that is the fluid compartment of the blood, then malaki yung blood volume mo. Therefore, malaki yung venous return, malaki yung stroke volume, malaki yung cardiac output, malaki yung mean arterial blood pressure. Okay? So, ngayon, what determines the amount of plasma that is in the blood? Number 1, yung dami ng asin at tubig. Why? Because salt, where sodium is, water will follow. So kung marami yung sodium in your plasma, it will attract more water and therefore expand the plasma, expand the blood volume, increase the venous return, increase the stroke volume, increase the cardiac output, and increase the blood pressure. Okay? But it's not only the amount of salt and the water that it attracts that determines blood volume. It is also determined by the calibration of tissues. The water in the tissue, how much of that water goes back into the blood vessel. And so um, that is a function of the um, how uh, how amenable the blood vessel is in accepting the fluid that is in the interstitium. So papasok din yun yung lymphatics, papasok din doon yung permeability ng inyong capillary. Okay? And lastly, salt and water so dito na nag-i-interconnect na yung dalawa. Salt and water balance. Gaano kadami yung asin at gaano kadami yung tubig, that is determined by the kidneys, and that we will discuss in a little while. Okay? So that's RAAS and vasopressin. Okay. Venous return is also determined by respiratory activity. So why? When you breathe, your thoracic wall, itong chest ninyo, yung thoracic wall expands. When the thoracic wall expands, negative pressure inside the wall increases. The inside of the chest becomes more negative. As the inside of the chest becomes more negative, okay, and your thorax together with the pleura, together with the pericardium, as they stretch out, they create a vacuum inside the chamber. And so when the inside of the heart expands, okay, that creates suctioning that draws out blood from the periphery back into the heart, increasing venous return. Okay? So ano ibig sabihin nun? Kung gaano ka expanded, no? Gaano ka expanded yung thorax, gaano ka free yung lungs sa pag-expand, gaano ka free or pliable yung heart sa pag-open up, that also determines venous return, stroke volume, cardiac output, and mean arterial blood pressure. Okay? Next, punta tayo dun sa other component of blood pressure, which is gaano ka close or open yung butas or lumen ng inyong blood vessel. And that determines total peripheral resistance. So, ano yung determinants nun? Gaano kalaki yung lumen ng artery, arteriolar radius. And arteriolar radius is affected by local metabolic control. Okay? Ano ibig sabihin nun? Kapag, ito yung autoregulation, kapag malaki yung output ng carbon dioxide ng tissue, magdadilate yung arterioles. And that will decrease the total peripheral resistance and decrease the mean arterial blood pressure. What about extrinsic vasoconstrictor control? So, number one, sympathetic activity and epinephrine. Remember where epinephrine is synthesized and how it flows in the blood. So, when epinephrine comes in contact with the blood vessel, it acts usually via alpha-1. So, remember your autonomic pharmacology. So, when alpha-1 is active, it causes vasoconstriction. The arteriolar radius decreases, and so, mas naiipit niya yung dugo, total peripheral resistance increases, and mean arterial blood pressure increases. Okay? Another, and this time, A long-term controller of blood pressure is the RAAS, no? Angiotensin 2 is the effector. When angiotensin 2 binds to its receptor, the angiotensin receptor, it causes the blood vessel to vasoconstrict. So the arteriolar radius decreases, the total peripheral resistance increases, and the mean arterial blood pressure increases. Okay? And lastly, blood viscosity. Okay? So, remember, kung ang inyong dugo ay mas maraming red blood cells, mas malapot siya. Kung siya ay mas malapot, then more sluggish ang kanyang pag-flow. And therefore, mas kailangan, mas mabigat siya, no? Kasi mas sluggish siya. Mas kailangan na um, it, it serves as afterload, no? Mas kailangan siyang labanan ng inyong puso as it is being pumped inside the blood vessels. So, blood viscosity then is determined by red blood cells, number of red blood cells, and if you are severely diabetic, the weight of glucose in the fluid of that is in the plasma. Okay, so for example, if your number of red blood cells go down in anemia, blood viscosity decreases, total peripheral resistance decreases, mean arterial blood pressure decreases. Okay? But I'd like to emphasize this, that anemia is not the opposite of hypertension. Kasi, di ba, mapapansin nyo sa med missions or sa duty ninyo sa botika, sasabihin na example, nagsiscreen kayo ng risk, no, for adverse events. Sasabihin nyo, ma'am, hypertensive po ba kayo? Hindi, anemic ako eh. Wrong, no? Not the same. Not the opposite of each other. Okay, you can be hypertensive even if you are anemic, but that is less likely. Okay? Okay, so with that, what are the mechanisms that control blood pressure? Dalawa lang. Meron kayong fast-acting mechanism that controls blood pressure and a longer-acting or slower-acting mechanism of controlling blood pressure. Yung acute control of blood pressure, isa lang dapat isipin nyo, it is via nervous control or effects of the nervous system. And this is mediated by the autonomic nervous system by way of norepinephrine releasing and acetylcholine releasing nerves. So, ganito siya. Acute control is given off by the nervous system. Why? Because transmission of information via the nervous system or by way of neurotransmission is very quick, and therefore it will be able to quickly cause adaptation towards challenges in blood pressure. So the sympathetic activity creates positive inotropy and chronotropy in the heart muscle via beta 1. Okay, so when norepinephrine is released by the cardiac sympathetic nerves, okay, it acts on the skeletal muscle. It acts on the cardiac muscle, and it acts on the cardiac muscle via the beta 1 receptor. And when it acts on the beta 1 receptor, it produces inotropy, strengthening of the cardiac contraction, and positive chronotropy, increase in heart rate. So, ano ibig sabihin nun? Stroke volume increases via inotropy, cardiac output increases. Increase in heart rate, cardiac output increases, and therefore, it increases blood pressure. The sympathetic nervous system also acts via the blood vessels. So when epinephrine binds to its receptors on the blood vessel via alpha 1, no, it causes vasoconstriction. So what happens when the arteries vasoconstrict, the resistance increases and the blood pressure increases. But when the veins constrict, okay, when the veins constrict, it's a different way. No, it's a different pathway. When the veins constrict, remember that they are capacitance vessels, they will push out the blood back to the circulation. And therefore, preload increases, stroke volume increases, cardiac output increases, blood pressure increases. So yung effects of the sympathetic nervous system on the vasculature depends on what blood vessel is being activated, no? Or on what blood vessel constricts. Okay, it's a different ball game when you talk of the vasculature of the skeletal muscles. The blood vessels of skeletal muscles have beta 2 receptors. And when epinephrine binds on the beta 2 receptors in the blood vessels of skeletal muscles, it causes vasodilation. Why? Remember that epinephrine is released when you exercise, no? During the fight or flight response. And when the blood vessels of skeletal muscles increase in diameter, blood flow to the skeletal muscles increase. Tama lang kasi kailangan nila ng more oxygen and nutrients to be able to produce muscular activity that the organism will be needing for fight or for flight or for exercise. Okay? Excuse me. Parasympathetically naman, paano nangyayari? It is by way again of the vagi or the vagus nerves, releasing acetylcholine. So when acetylcholine is released into the heart, it's so intricate that these parasympathetic nerve fibers are directly synapsing at the sinoatrial node, which is the pacemaker of the body. So when the sinoatrial node is activated by acetylcholine, the response will be to decrease its intrinsic firing. So babagal siya. It causes negative chronotropy. And with a decrease in heart rate, there will be a commensurate decrease in cardiac output and blood pressure. Okay? So yun yung effect niya. Ngayon, yung acute control of blood pressure is highly reliant on reflexes. Ibig sabihin nun, reflexes are patterned neural responses that are beyond our conscious perception or conscious control. So, one example is the Bainbridge reflex. So that's quite advanced na. But what happens in the Bainbridge reflex is when there is excessive stretch of the right ventricle. Anong ibig sabihin nun pag nasa-stretch yung right ventricle? Ibig sabihin nun, marami yung dugo kasi nasa-stretch siya. A reflex is sent to the spinal cord, no, by way of the sympathetic nervous system, and it is also sent to the region of the brainstem by way of the vagus nerves and the glossopharyngeal nerves. Na-activate yung pathways na yon, and at the end of that pathway, it tells the heart to beat faster. So when the heart beats faster, it is able to pump out more blood, and therefore it is able to um, correct the stimulus, which is stretching of the heart muscle, of the heart wall. So ulitin ko, na-stretch yung sa vein bridge reflex, na-stretch yung heart wall, iisipin ng katawan, sobrang daming blood kasi nasa-stretch siya. So, it will send out information to the brainstem and the spinal cord, and the brainstem and the spinal cord in turn sends back information causing the heart to pump faster so that that excess blood that stretched the heart wall in the first place is pumped out. Okay, so yun yung vein bridge reflex. May pa isang reflex which is the Barrow receptor reflex. Okay, so yung dito naman, it's the opposite. It's usually activated when there is a decrease in blood volume or blood pressure. So, let us say, hindi ka umiinom ng tubig or you're losing a lot of blood. Okay? So, for each pump of the heart, little blood goes out. So, ang nangyayari dyan, yung stretch receptors that are found in the arch of the aorta and in the carotid sinus are not stretched anymore. Okay? Kasi konti yung blood flow, hindi siya nasa-stretch. So when they are not stretched, they will activate the vasomotor centers in the medulla oblongata, which is a part of the brainstem. And these vasomotor centers send out information via the sympathetic nervous system, causing increase in heart rate. So, when there is an increase in heart rate, there will be an increase in cardiac output. And this time, after correction via the baroreceptor mechanism, mas-stretch na ulit yung baroreceptors in the aorta and the carotid sinus. So, ano ibig sabihin nun? Noong una, konti pa yung blood flow, madedetect ng big blood vessels, kulang yung blood flow. Sige, pabilisin natin yung tibok ng puso para tumaas yung cardiac output at para maging normal yung blood pressure so that I can perfuse my tissues. Okay? So, yun yung baroreceptor reflex. Okay, that normalizes blood pressure. You may be able to appreciate the baroreceptor reflex when you are volume depleted tapos bigla kayong tatayo, no? So, nakahiga kayo, kulang kayo sa tubig or whatever that decreases your blood volume. And when you suddenly stand up from lying on your bed, mapapansin niyo sobrang bilis ng tibok ng puso. And that is the baroreceptor reflex in action. Okay? Okay. And lastly, the long-term regulation of blood pressure. So, for the long-term regulation of blood pressure, we are dependent on humoral mechanisms. Ibig sabihin ng humoral, it acts or it is associated with the fluids of the body. So, dahil dyan, yung main players of the humoral regulation of blood pressure are the kidney and the pituitary gland. Okay? So, unahin natin yung sa kidney. Bakit ba meron itong regulation na ito? Kasi if the kidneys are not receiving adequate blood they will have to tell the body, I'm not receiving adequate blood flow, so I want you now to increase your blood volume so that I will receive adequate blood flow again. Kuha niyo yun? So, first, the kidneys will not receive adequate blood flow. So, when the kidneys do not receive adequate blood flow, so look at the upper left portion of the diagram. Without adequate blood flow, they won't be able to filter out an adequate amount of sodium. So yung unang masasense ng kidney, konti yung dugo, konti yung ma-filter out niya na sodium sa kanyang nephron. So kapag konti yung sodium na nasa loob ng nephron niya, i-activate niya ang tissues around the glomerulus to secrete renin. And so what we are discussing right now is the renin-angiotensin aldosterone system. So when that portion of the nephron, the juxtaglomerular tissues or the juxtaglomerular apparatus secretes renin, renin now goes into the blood. And once it is secreted in the blood, it will act upon a protein that is secreted by the liver into the blood. And that protein is angiotensinogen. Angiotensinogen is cleaved by renin, tatanggalan niya ng amino acids, and it produces angiotensin 1. Nasa dugo lang yun, paikot-ikot. Once it flows into the endothelium that is present in the blood vessels in the lung, it is acted upon by the enzyme in that endothelium. And that is angiotensin converting enzyme, which again cleaves the angiotensin 1 further. Tatanggalan niya pa ng amino acids. And it produces angiotensin 2. Angiotensin 2 right now is the potent effector. It will be able to bind to its receptors in the blood vessel and cause vasoconstriction. So once there is vasoconstriction, total peripheral resistance increases, and therefore blood pressure, mean arterial pressure increases. And so yung puwersa, no, blood pressure increases, it will then be able to force the blood to flow to the collapsed blood vessels in the kidney. And therefore, the filtration in the kidney increases, and the amount of sodium that reaches the nephron will increase na. Kasi meron ng blood na dumaloy sa kanya. Okay, so that reverses the stimulus. Okay? Na kanina, konti yung blood, kaya konti yung sodium, kaya i-activate ko ang renin. Ngayon, na-activate na yung renin, nakaproduce na ng angiotensin 2, nag-constrict yung blood vessels, and therefore tumaas yung blood pressure, tumaas yung glomerular filtration, nakaproduce ako ng maraming sodium. Naka-filter ako ng maraming sodium. Okay? But it does not stop there. Angiotensin 2 is also a potent stimulator of aldosterone. And aldosterone is secreted by the outermost layer of the adrenal cortex, the zona glomerulosa. The zona glomerulosa, okay, secretes aldosterone, which acts on the distal portions of the nephron. So sa mas malayong portion ng nephron. Doon sa malayong portion ng nephron, it causes the reabsorption of sodium, and therefore, when sodium that should have been lost in the urine is reabsorbed into the fluids of the body, it will also reabsorb the water. And when the water increases, the plasma volume increases, the blood volume increases, the venous return increases. Okay, the cardiac output increases by increasing the stroke volume, and therefore the blood pressure increases. When the blood pressure increases, the perfusion of the kidneys increase, the glomerular filtration increases, sodium that is delivered to the distal nephron increases. Okay? But take note, these happen in the fluids of the body. Therefore, they are slow to act, but their response is extremely powerful and it is long lasting. Okay, so that is the long-term regulation of blood pressure. But at the same time, I want you now to appreciate that angiotensin 2 together with aldosterone does not only affect those mechanisms, vasoconstriction and water reabsorption, they also cause a structural change in the blood vessel. Okay? They cause the blood vessels to proliferate, no? So that's vasculogenesis that is produced by angiotensin. But at the same time, they also cause the heart to remodel. They will tell the heart to thicken up because you need to produce more force to counteract the increased peripheral resistance. Okay, so angiotensin 2 and aldosterone cause cardiac remodeling. And in cardiology, whenever the doctors will find out that the heart has already adapted or remodeled, that is an indicator of increased risk of adverse cardiac events. Okay? So, anong ibig sabihin nun? When we are in pharmacology, the application is when we give medications that block angiotensin 2, the activity of angiotensin 2, and the activity of aldosterone, this directly translates to decreased cardiac remodeling and increased patient survival. So these drugs have a survival advantage or benefit. They cause the patients to live longer. Okay, so those are um, the ways by which blood pressure is regulated in the acute and chronic setup. So I just like to revisit what we have discussed so far. That's a lot, no? The anatomy of the heart, the overview of the circulation, what's the microcirculation, how blood flow is regulated, how blood pressure is determined, what are these factors, and how these factors play about in the control of blood pressure. So next time, we will already be discussing the applications of these concepts, how we treat diseases, and how the drugs that we give alter these fundamental functions of the body. Okay, so next time, we will be discussing a condition of low blood flow in the body, and that is shock, and what drugs we can give to treat shock, and also um, what happens when there is alteration in blood pressure such that the BP is so high. So there are a lot of things that can be underneath a very high BP. And what can we give patients so that their BP goes down? And what are the effects of these medications on um, the determinants of blood pressure and the physiology of blood pressure control? Okay, so see you on our next meeting, and I hope you uh, get to enjoy this lesson. Thank you.